Hey everyone, we are continuing with the health talk. This is a representative for the Shut Up or Talk Up wellness lifestyle brand where we focus on mental health, emotional health, and physical health. And we are excited to have the opportunity to communicate with so many health and wellness contributors all over the world, literally. And our next stop is in at ATL. We have the honor of speaking with Dr. Kayhla Williams. She is the chiropractor in ATL, right? I saw
Yes,
that in the bio.
ma'am. Yes, ma'am.
Get it right. How are you doing today?
I'm doing well. How are you?
I'm fine. You know, the sun is up, we're alive, so that's all we need
Yes,
right now.
ma'am.
And so the purpose of this health talk is to really kind of introduce and not so much introduce, but just share insight, different insight with our audience, and in case they needed to go somewhere or looking for a provider. And you are a chiropractor, and nowadays everybody need their back broken. So do you just break back all day, or tell us what you do?
Yes, ma'am. So I am a chiropractor in Atlanta, Georgia. So essentially what a chiropractor is we treat the neuromusculoskeletal system. So most people come to chiropractors for neck and back pain or after they were in an accident. But basically what the adjustment does, and an adjustment is the pops you hear when you go to a chiropractor, right? So what the adjustment does is it just restores motion back into the joint so that it can function properly. Because when it's not functioning properly, that's usually when pain comes. So when people get pain, that's usually when they seek out a chiropractor. So that's what we do.
Okay, so I have some questions. I've seen some videos, and I like to watch the videos, but every time I watch videos of anyone getting their back crack, I'm like, I think I want that. It's like one of those things that you like, but you kind of know, like, maybe if I get that crack. So, what would you say to a new patient, with them being tense or already tense because of whatever's going on with their back, but then just afraid of whatever the process may be,
right,
that back.
Right. So whenever I get a new patient, I walk them through every single step so they're not surprised by anything, so that they won't tense up.
Okay.
Well, like the sound is just gas coming out of the joint. So it doesn't hurt. Oh. It just makes a really crazy sound. It's just like popping your knuckles. It's just gas in the joint. So I try to prep them for everything. Of course, people are still going to tense up because I'm moving you in ways that you've never been moved before.
Yeah. So
like, I just walk you through it.
Okay.
And they usually relax. So
okay. All right. So as far as like the different positions, like, so obviously you're trained to do this.
Right.
And so, like, are there specific positions for men and women, or a back is just a back? So how does that work?
Yeah, most people look at me because I'm only 5'2". So they're like, you can't do anything.
Like what?
The big. You're right. Like lay on the table. But a joint, it's about line of drive is what we call it, and the correct force. So it doesn't matter my size. I just need to know which way the joint needs to move, and I just move it in that direction. So it doesn't matter the size of the patient, man, woman, linebacker, whoever.
Like you can get it. Right. So what about dislocation, like shoulder dislocation? Like I've seen and I've had friends like in the past when people talk about how their shoulder were dislocated and they needed someone to pop it back.
Yeah.
Come on, Dr. K, let us know, like, like, is it that simple for some situations?
If you know what you're doing, yes. I would let anybody do it, because you need to make sure there's no tissues damaged around that joint before you go and manipulate it back into where it's supposed to be. So don't let just make sure it's a trained professional.
Right. Listen, y'all don't fool around. Just make your appointment.
Don't let your friends walk on your back. I had a girl, she let her trainer adjust like her mid back and it damaged the nerve. And I'm like, y'all gotta stop letting, because they'll watch these, like, it's like a love and hate thing with the internet, right? You got TikTok, Instagram, you have YouTube, and you can see these people and they're like, oh, that looks simple. I can just do
I can do it.
But we trained for years before we just went out, you know, and people. So
yeah.
Make sure you go to somebody who know what they're doing.
Yeah, that's a valid point. And I have, my mind is just racing now, because when we think about, you said joints, and you know, I've taken anatomy, physiology in school and all, and you know, but now that I'm thinking about it, I think everyone thinks that everything is just bones, right?
Right.
So whenever we hear a crack, we think it's a bone being broken. Well,
right.
Bone, like, ow,
right.
Like, you know. So, you know, for me, anytime I hear a crack, and it's so weird because I used to crack my knuckles and all that. And I don't do it often anymore, but or I'll just turn or something like that. But anytime I hear a crack, I associate the cracking sound with the bone. And now that but hearing you say the term joints, so what can you, like, what normally happens? Like, the joint is like the end of the bone, or two bones?
It's where the bones basically connect with each other.
Okay.
Makes a joint, right? And so around those joints, we have these fluid filled pockets, right? And then if they become misaligned, they'll start to fill up with gas, basically. So when you put
it's fluid that keeps it together?
It's fluid around that joint.
Okay. So
if it gets misaligned, that joint is gonna fill up with gas.
Pain.
Yeah. So when we put it, we don't actually move, because I heard people say, oh, you're gonna move my bone and you're gonna break my back. I'm like, I'm not moving it. If I move your bone, I'm wrong. I don't want to move your bone. What I do want to do is put motion back into it. So you the end range and just like kind of put it back to where they're aligned again.
Okay.
What happens is we use a little bit of force. So when you push it back, that gas just pops out. So you hear those popping noises.
Okay.
So it's actually a joint that you're moving and not the actual like bone.
Okay. That's why you're the doctor. You know, even when I would, like, you know, crack my back a little or whatever, I'm thinking, I still relate it to me cracking a bone. Maybe you can do like just a clarification on that, or maybe you probably have, but I think that is what freaks a lot of people out. Just really understanding it's not your bone, it's the joint.
That's a good point. I'm gonna have to do a video about that.
Oh, that would be so good. Just
if you thought it, a lot of people have thought it. So
that's a fair.
You know, there's always this resistance when you talk about, mainly because of the videos that are out there.
Yeah.
It's this resistance, like, I don't want to get my bones broken or cracked or whatever. But a lot of misinformation about the profession out there. So that's actually a good point. I need to do a video about that.
Yeah, and you guys got to make sure you go to her page. She have a lot of education on there, a lot of videos, a lot of relatable stuff, and, you know, check it out. I mean, because I'm glad, that's why we're having these conversations, you know. As a life coach, I mean, my profession is more network tech, right? But I'm also a life coach. And one of the reasons why we decided to reach out to other providers, because for me, I feel like, I know I'm smart, you know, and I'm good in a lot of things, but if there is something that I am not good at, I am going to ask those who are equipped, those who just time to go to school for it. And there's certain things I just don't know. So I just have to hold myself accountable with what I know and what I don't know, and reach out so I can educate, you know, our audience with the people that know, and you know. So, you know, so in regards to, I saw that, you know, you handle a vehicle accidents and pregnancy. Can you tell me a little bit about, I guess I can imagine, like, with vehicle accidents, how you know, what that process is, but you are able to, I guess, crack joints during pregnancy or something like that? Or how does that work?
Yeah. So as far as accidents go, that's usually how most people are introduced to chiropractic. They get into an accident and they're told to go to the chiropractor to get back to how they were pre-injury. So we work on the soft tissues, the joints, the muscles, and then we get into exercises, basically rehab them back to their daily activities without having any pain. The pregnant people, listen, that is my favorite. I love the pregnant, love the babies. That is my thing. Like, I don't even have pregnant women get into accidents, so it's all bad. But as far as pregnancy goes, your body is changing, right? And then you have all these hormones that are loosening up, you know, the ligaments and the bones and stuff, getting ready for labor. And then as the baby grows, it starts to change how your back is. So we call it a lordosis in your lower back. And then when you start to grow the belly, that lordosis becomes increased and it kind of jams those joints in your back. So it causes some lower back pain. And then just the weight of the baby itself is just going to put stress on the back. So we work on the muscles in the back and we balance the pelvis because that body is getting ready for labor, right? So that this will start to become a little bit soft and it'll become a little bit imbalanced. So we just balance that pelvis out so the baby has enough room to move around, grow, turn, go head down, whatever it needs to do. And most pregnant women get a lot of relief from the chiropractic care. So that's why.
Imagine. So
they can't take medication, so they can't take pain medication. They can't take muscle relaxers. So there's the massage and chiropractic adjustments. So that's
good. So I also saw that you have sports recovery. Can you tell us about sports recovery? What happens with that, or what type of injuries, what type of athletes, or?
Yeah, I have a couple athletes. I have a couple of NFL players now. They come to me during their off season. But the same thing, if you get injured, like a sprain, strain during workout, or if you're a professional player or whatever, you know, you have those muscles and same thing, you make sure the joints are moving the way that they're supposed to, because our theory is that if the spine is functioning properly, then you're at your optimum performance. So a lot of professional athletes, we actually have some baseball players that come in the office as well. But they just, you know, when their shoulders get locked up, if they have to pitch, you know, we can work on the muscles around the shoulder and get those to relax, and then they have a better reach when they throw. So it's just.
So how does shoulder get locked up? Do they need some DW40?
Listen, we all need to do. After 30, I don't know what happens. But DW40, but basically the muscles just get, like when you're doing repetitive actions over and over.
Okay.
So we'll just tighten up and it'll restrict those joints. So you just want to keep those relaxed. Do just recovery. I always tell people, if you want to work out hard or play sports hard, just make sure you're doing the recovery as well, because it'll catch up with you over time if you're not. Even if it's just simple stretching, you work out. But most people don't. When they're done, they're done.
Yeah, and so I also noticed that, you know, you have wellness. So entirely, you know, your practice, you focus on wellness with all aspects of what you do, correct?
Right.
Okay. That's
I always encourage, like, if you get into an accident, like I said, most people, they only know chiropractic through being into an accident, but when I, you know, explain the philosophy behind it, like it, so back, I didn't even explain it to you guys, but so our theory is that we treat the neuromusculoskeletal system, right? So you have the brain and the spinal cord, and then you have these nerves that go out to the body. And basically every structure, every organ in your body is innervated by a nerve that comes out or branches off from a nerve that comes from the spine. So that if you have a misalignment in your spine, it's going to put an irritation on that nerve, and whatever that nerve goes to might not be functioning properly. So we try to get to pain or illness or disease before it happens. So that's why we focus mainly on wellness. So even if we we get you to a recovery stage, we want you to come back for maintenance, whether it be
maintenance
once every
for
3 months.
preventative measures.
Yeah, for preventative issues. Because if everything is moving and functioning properly, you have risk of it becoming dysfunctional.
Okay, so I have a few notes here. I want to talk about scoliosis. What is the scoliosis and how is that treated?
So scoliosis is basically a curve in the back. So
like
they screen for it when you're in like elementary school. And if the curve is more than a certain degree, then it actually has to be surgically corrected. If it's not, then you can do chiropractic. Of course, I'm going to always advocate chiropractic first, or you can do physical therapy, which will help decrease the curve in there. If it's nothing that's like too bad, like some curves are too bad where your organs have to shift, or it's just misplaced so bad that you can't grow properly, or it might put a irritation on the organs, then they'll correct it. But if not, then you just grow and you just have a curve, but it just might turn into you having like chronic pain.
Okay. Yeah.
So physical therapy and chiropractic are good for that. But it is a long-term treatment. So you might have to go, through a year. Like it won't be like one treatment.
Right. So like a wham bam.
Yeah.
So I see a lot of people go into like cold tubs a lot, ice tubs. And I'm like, ooh, y'all keep doing it.
Right.
But I'm like this, I'm a nerd. I love to learn. That's why I'm over here talking to, doctors and individuals to get just learn. And I'm kind of intrigued. I want to know, like, how does the ice cold tub or whatever that called, how does it reset? Does it reset your back? Does it ease pain, or what is it, a more tissue thing or a bone thing?
It's more muscle and tissue.
Okay.
Most people call it cryotherapy because you can get into these machines where it's not even ice, it's just this super cold, like
air?
Call it, yeah.
Like a fog.
Yeah. But it's really, really good, especially if you're an athlete. It really helps with recovery. But just inflammation, period. It really helps with inflammation in the body. So if you kind of like, let's say you injure yourself, right? The first thing that you want to do is ice it because it shuts off the blood supply to that area.
Okay.
When you get an injury or anything, the first thing the body's going to do is shove. It causes an inflammatory process, so it shoves blood to the area. But you have all these inflammatory things that go to the area too. So if you shut off that blood supply, it'll kind of go away from that and calm it down a lot. So that's why you see a lot of athletes do it, because it recovers faster.
Oh, okay. I see that. I'm like, oh wow. That's like, and they go all the way in. I'm like, I could do my pinky toe. That's it. Right. I'm like, oh, I'm good.
Yeah, but they love it though. I've never done it. I'm like you. I'm like, that's a little bit extreme for me.
Yeah, I see people do it, and they're like in Colorado in the snow, like they're around the snow and the ice. So I'm just looking at them like, okay.
Right.
So it's hilarious, but I want to do it. That's something that I do want to do it. But if I was to do it, I need to be like in Jamaica with the sun. So as soon as I pop out, I'm like.
Right. Yeah, I don't know what it'll take for me to do it, but I agree with the theory. It's a good theory.
Yeah.
I know a lot of people that do it, but for me,
yeah, I definitely understand. And so I want you to help our audience understand, including myself. So we have the chiropractor, and then we have PT, physical therapy, and then we have a massage therapy. therapist. What are the differences, and what are the differences between all three? Or
Oh, yeah, all three. There's a lot of crossover with physical therapy and chiropractors.
okay.
So, physical therapists focus more on exercises and stretches. So they're more active care. So basically, you're doing the work. They do some modalities too. So they'll do like what we call electrical stimulation, where they put these little pads on. You'll feel like a little tingle, but it just gets the muscles to relax. So that's pretty passive, where they'll do a little bit of muscle work, but mostly they do therapeutic exercise. They're starting to manipulate, which is what chiropractors do.
Right over here crossing in y'all lane.
Yeah, right.
I see y'all.
Right. But I have to say, I just have to say, they take like a weekend class on manipulation and then they start to do it. But chiropractors, we do more manipulating and stretching and like manual therapy, muscle work, kind of like trigger point therapy, which is likened to the massage, except we're not doing like whole full body, muscle work for an hour. We're not doing that.
Okay.
We're doing like one area where we find a spasm. So
okay.
Over chiropractors can diagnose.
And you guys
cannot.
Okay. And you guys do prescriptions?
We do not need, no, we don't do prescriptions.
Okay. Okay.
Don't do any drugs or surgeries.
Okay.
Physical therapists don't either.
But none of them can diagnose.
No, neither one of them can diagnose.
Oh, okay.
Diagnose. You have to have, as of right now, you have to have a referral to go to a physical therapist. They're starting to get away from that. I believe you can do like a couple of visits before you have to a referral. But that's pretty much it. We do everything more passive. Physical therapists do things more active. Massage therapists focus mostly on muscle.
On muscle, okay. All right. Well, thank you for clarifying that. I also, I was curious. So I have a little bust, but I remember growing up, I've had some school friends that had to get like a breast reduction because it was causing back pain. So can you explain how, like, what's the process with that, or not so much of the breast reduction, but just, why does that happen?
Yeah, so people with large breasts, I actually have a few patients that are considering breast reductions right now just because the breasts are so heavy for their frame. It just causes a lot of stress on their upper back. So the same thing, like when you have so much weight in front of you, it's kind of pulling everything forward, making your shoulders round. So that puts a lot of stress on your upper back muscles. So, I had a girl, she was considering a breast reduction because she had pain for like 6 years, like basically since she was in high school, and she was like, but she was considering it, but she came to the office to get it approved, because you have to say like, I tried these things.
Yeah.
Approved the surgery, but she actually got relief from the care. So like putting that off to see,
how long was it? Yeah.
Yeah, but again, with that, you have to be consistent with care.
Yeah.
So like,
and that goes back to the wellness.
Right. If you want a little quick fix, just go ahead and, have the surgery. But if it's something you want to keep, we can definitely help you manage that pain.
Yeah, I mean, it's definitely something that I've thought about. I remember in high school, one of our friends, school friends, classmates, she had to have her surgery, and she came back, and her breast was like smaller, and so we all was happy for her. She was like, I don't care what anybody say, I want little boobs. I was like, oh, little titties matter. But
But you know what? The opposite happens too when they go and get breast implant,
Mm-hmm.
or even BB, like they're starting to get BBLs and get lower back pain because you have the extra weight on your lower back.
Oh, I never thought
And,
about that.
yeah,
Because
and
it's
then
dragging down the back.
yeah.
Oh, yeah.
And the breast implants, you know, when you get them huge like that, I'm like, that's gonna put a lot of stress on your upper.
What? Yeah, you know, I'm like, you know, that's a strong back, you know,
Right.
because I don't have it in me. I definitely do not have that in me, but I do know that, you know, everybody's body structure is different.
Right.
You know, I mean, we have the same organs, but you know, the
Mhm.
frame. I'm
Right.
5'3", you know, on a good day.
Right.
So, you know, but
Right.
I definitely think it's important. And you know, even when I think about chiropractic, do you make like visits to jobs, or that's something that you don't just randomly, it has to be, let's say someone wants to hire you to come and like break some backs. I keep saying break back, but
Yeah.
but do you do like on-site visits, or is that more of a PT or a massage therapist thing?
Yeah, I do in-home visits. I do in-home and
Oh, okay.
Occasionally.
Okay, right.
I prefer to get like a company so I can have multiple people in
Right. Because
space.
then it will only be, yeah.
Yeah, but I definitely do in-home visits. It
Mhm.
I have more equipment in office,
Okay.
so I prefer people come to the office, but we can get it done. It doesn't
I,
matter.
I understand. What
Yeah.
about back braces?
Mhm.
Like, what are they like? Are they different types of back braces,
Yes.
or
If
what
you
is it?
have like a really bad injury, like most people will, not most people, some people will go get a back brace if they start having pain. But I don't recommend that. And if you do wear it, I only recommend you wear it 2 hours a day, because what will happen is it's supporting you so much that your muscles don't have to do anything. So it's making those back muscles.
Lazy. Oh,
So it's not doing anything for the problem. Is actually going to make it worse if you wear it too long over time.
okay. Yeah, I could imagine that with, you know,
Yeah.
with that type of pain. And so lastly, children, back
Mhm.
pains in kids, like, is can back pain be hereditary, or
It's
like,
usually not a hereditary thing. It's usually like a genetic makeup. Like you have the same. So I guess you can't say it's hereditary, but it's more like how if you're made up the same as your parent, have the same issues.
I understand what you're saying though.
Yeah.
Yeah.
Or if you're no, you are on the heavier side.
Mhm.
It's all right. It's like usually the same behaviors or the same
Okay.
or the same mannerisms that
Okay.
hate the same issues.
So can kids have back problems? Like randomly, like with no car accident, can they start just having back problems? Like, and they ain't even lift a broom, they ain't watch no
Right.
dishes. They didn't even
Rarely.
do their homework and they got back
Right.
problems.
Now,
Poor baby.
yeah, now it's you know, we was growing up, we went outside to play. We could fall off the roof and we were fine.
Yeah.
Now you have this more sedentary group of kids. They sit and watch computers, they're looking at phones, looking at tablets.
Oh, and they probably like this
They're
on.
like this all day long.
Oh, what is
So
that
that
doing?
causes, yeah, that causes a lot of stress on your upper back. They actually have studies now that even in adults now, they're saying that these sedentary jobs that we have is actually more harmful on our health than smoking cigarettes.
Wow.
So I'm like, put them kids back outside, like take them tablets, like.
Yeah, needs to be active.
So what's going to happen is I'm predicting that they're going to actually I'm seeing 20-year-olds with spines worse than 40 and 50-year-olds, and I'm like, it's not. This is I'm pretty sure it's from all the technology.
Yeah. Yeah.
So if anything, they have issues from that. Mostly kids come in, or parents bring their kids, they have like digestive issues or
What, but you don't do the feet. That's a podiatrist. You only do back?
just feet. If it's like a bone spur or like I can do, they call it plantar fasciitis, which is just basically the ligament in your foot. It'll get tight. We can work on that. You know, we can adjust, the ankle. We can do stuff like that, but you go past.
Oh, okay.
Yeah, that's podiatrist.
Yeah, okay. I feel what you're saying. But yeah, I mean, that's definitely awesome. I mean, I want to thank you so much for having this conversation with me today. The sun was a little bit bright. I don't know if you guys see it, but it's getting dark where I'm at. So, but any last words or insight? And also if you can share your social media handles, your location, where you're located, how people can reach you directly.
Mhm. Yeah, so I am in Midtown Atlanta. My Instagram handle is Dr. _K Chiro. So Chiro. So there's Dr. K_Chiro. And you can send me a message whenever. I also have my website in the bio. So you can go in there and put your information in. If you want to request an appointment, you can just send me a message and say that. Or if you just have a question, you can shoot me your question or whatever. I know it's a lot to cover in a short amount of time, but if you are having issues, definitely come in so we can examine you and get you a diagnosis and see whatever treatment that you need. And also, like whatever kind of issue that you're having, if you feel like it's something that we can't treat, like first let me decide that.
Yeah, ask.
Right. I know I work with a lot of other specialties, so I know who to put you in the direction of or refer. Just, don't keep putting it off. It's probably gonna
don't blame the doctor, ask the doctor.
Right. Don't mess with Dr. Google. Get off.
Yeah. Yeah, that's definitely having everybody think they can crack backs out here.
Okay. Listen.
So Dr. K, I just want to say thank you so much for having this conversation. We really appreciate it. You gave a lot of jewels. We talked about scoliosis. We talked about the purpose and the core values of being a chiropractor. We talked about you explained the difference between massage therapy, physical therapy, chiropractor. We talked about the cold showers, accidents, wellness. I love the fact that you focus on wellness because that means it's continuous care that you'll be providing. And you guys make sure you tune in, you check her out, go to the website, and have a great day. Bye.
Thank you. Thank you, guys.
All right. Thank you.